Chronic pain caused by arthritic and deteriorating knees can be debilitating, and many patients put off knee replacement surgery for the fear of a long, painful recovery. Doctors say new technology is giving patients hope for a pain-free future. Our Tracy Sears has this Working for Your Health report.
Mike Haudricourt is recovering from his second total knee replacement.
I was doing injections and physical therapy. I even had a brace at one point, and it just got to the point where it was time to do it.
How you feeling?
It doesn't hurt.
Haudricourt turned to orthopedic surgeon Nordt at Parham Doctors Hospital to help find relief from the degenerative and painful knees that kept him from being active.
Our goal is to make that so they don't know they've had an artificial joint, that it feels perfectly like a normal knee.
Newer technology is doing just that, designing surgeries specific to a patient's anatomy.
If we decide that this patient would have a better outcome if that slope was 4 degrees, we can make that 4 degrees. We could make it 3.5 degrees.
The state-of-the-art Mako system uses a patient's CT scan to create a 3D model of the knee. This allows doctors to pre-plan a patient's surgery. In the operating room, a surgical arm guides doctors removing bone and tissue to position the implant with precision.
There's no question in terms of accuracy that this allows us to be exceedingly more accurate than we can with conventional instruments. So we know we're putting these knees in perfectly.
The less invasive surgery means less recovery time and easier mobility.
It's better than it ever was in my life, maybe.
Haudricourt says his first knee replacement last year gave him the confidence to do surgery a second time.
Probably about 6 weeks after the surgery, let's say early April, I was able to do the things I enjoy, like riding my bike, walking, and swimming.
While the long-term effects of this surgery are still unknown, doctors like Nordt are optimistic. Working for your health, I'm Tracy Sears.